Most cases of skin cancer occur in adults, with the highest frequency among older adults. And according to the American Cancer Society, there are more new cases of skin cancer each year than the combined incidence of cancers of the breast, prostate, lung, and colon. And if that weren't bad enough, another study suggests that up to 90% of the visible changes commonly attributed to aging are caused by the sun. Here to talk to us about skin cancer is Mark Brown with the Medical Center Clinic's Dermatology and Laser Center. Mark, thanks for being here.
Thanks, Jeff.
Well, let's talk about, first of all, why older adults?
Older adults, generally, it would be two main reasons. One would be just generally skin thinning with time and overall cumulative sun exposure. And the second reason would be as you age, unfortunately, with time, your immune system decreases, which prevents your body's ability to sort of fend off the UV radiation that you receive from the sun, which would hinder your body's ability to minimize the amount of skin cancers that you have. That's why we see more skin cancers with aging.
Mm-hmm. So it's not just cumulative years of, oh, you know, I went to the sun when people use Coca-Cola and baby oil and that kind of thing, or but you're talking about actual thinning of the skin and the immune issue.
Yes, it's both. It's definitely cumulative effect of the sun exposure is a extremely important factor in this, but we are definitely seeing that now a lot of it has to do with immune system issues, and that's some of the reasons why you see people who have had transplants and have immune system issues have more problems with skin cancers than most individuals do.
So as far as though that history, I know was noticing we were talking earlier about the larger number of men affected by this than women, and what would you say to that?
I would say that at this point in time now we see far more men with skin cancers than we do women. I think that most likely it's probably more occupationally and recreationally related. Brick masons, farmers, things of that nature who spent their entire life out in the sun, who did not know of the dangers of the sun and did not know of the protection of skin cancer, and it wasn't even developed when they were younger. Also recreationally, older individuals may be retired, love golfing, love playing tennis, love being outdoors and gardening, and that again plays into the cumulative effect. But I do think that in time we'll start to see more of a shift towards women, because there is more direction towards white-collar indoor work environment especially, and many more people are using tanning beds and being out in the sun recreationally than they did in the past tanning, and I think that will sort of have a carryover effect to later in life, especially with women.
Well, I'm sure many people know the history part of what, you know, might make them more vulnerable, but do people really understand the issues about the immune system and just the thinning of the skin, and do they take that into the consideration, or do people say, well, I've never really had an issue with sunburning in the past, so why should I change? What kind of education needs to be out there about those senior factors?
I'd say most people generally don't understand how much sun exposure they actually get. Even people who did not work outdoors, they may even work indoors at this point, or have worked indoors most of their life, or have generally never burned and have a more tan skin type. They may think, well, I've never really burned. I wasn't out in the sun a whole bunch as a child. I don't wear sunscreen, but I don't really take the precautions necessary, but it's not a big deal. Well, people don't understand you get so much sun exposure and UV radiation actually through the window of your car when you're driving. When you're playing golf, you may wear a hat or long sleeves, but you're still getting a lot of that sun on your face. Walking to and from appointments, things of that nature. When you're outdoors, being outdoors, it basically has the cumulative effect, and you get a lot more sun than you think.
Well, you mentioned sunscreen. I know in the past, if something had 20 or 25, that was a huge number to be on there. Now you see everything from 70 and on up on packaging. What's product and what's hype?
I'm not necessarily buying into the 100 plus SPF sunscreens. I think that they'll have a protective factor, but regardless of the SPF, I always recommend at least a 30 broad spectrum UVA, UVB. But even if you have 100, I still recommend people to reapply every 2 hours, 3 hours at most. When you get down into 8, 10, 12 SPF, you just don't have the lasting protection that you need, and you really have to reapply every 20 to 30 minutes, which most people just will not do.
Someone mentioned to me the other day they were looking for one that had titanium in it.
There's dozens of different sunscreens and chemicals that can cause sunscreen and blockage. It basically depends on what you're looking for. If you're looking for something more natural, zinc oxide and things of that nature would be a good product. But the titaniums, the oxobenzones, things of that nature are more synthetic, but they still give good protection.
Okay.
As well.
Well, so what should people be looking for on their bodies that might, result in, say, maybe they want to come see someone like yourself?
The more common types of skin cancers that we see are basal cell carcinomas and squamous cell carcinomas. They tend to be red, a bit raised, sometimes skin colored, irritated, and seem to not want to heal and are flaky, thick, crusted. If you have something that's red, scaly, flaky, uncomfortable on a sun-exposed area, it's pretty much a skin cancer till proven otherwise. And generally, those are the ones that people don't think would be skin cancers. They look more for the dark moles, which could be a melanoma, but those are the ones that you want to look out for. And any dark changing mole especially is worrisome.
So what kind of treatment is available these days?
There's numerous different types of treatment, especially for melanomas, which are the more dangerous type of skin cancer. You're looking at excision, which is basically cutting the spot out with stitches. There's also a procedure called an EDNC, which is electrodesiccation and curettage, and that's basically a scraping of the lesion out with a circular knife and cauterizing this to make sure it doesn't come back. And there's also topical treatments, which are sort of like chemotherapy, and those are effective, not quite as effective as the two previously mentioned ones, but we're coming along in those, that's for sure.
In your experience, do you find that most people do go to a professional at a good stage, or do they typically just put it off and put it off and put it off? And what would you say to that?
I think with skin issues, people tend to put things off way too far, just because they just assume that it's just a mole or it's just a skin cancer and it's not a big deal. They don't realize that certain types of skin cancer and skin issues can be very dangerous, and I think they wait too long.
Okay. Well, if our viewers wanted to get more information, do you have a phone number or a website or any place that you might recommend that they read up on this subject?
American Academy of Dermatology, which would be www.aad.org, has all kinds of good information actually for providers and for laymen in the community.
Great. Well, Mark, thank you for being here. It's perfect time.
Thanks.